What food should I avoid or limit in your diet to protect your kidneys? And how do you manage your kidney disease effectively? These are both important questions. Now, if you have kidney disease, it's essential to follow a balanced diet that helps manage your condition. Typically, this involves limiting foods high in sodium, potassium, and phosphorus. Let's get into the specifics. There are a few foods you should stay away from in your diet. Firstly, limit protein. While protein is essential for overall health, too much protein can strain the kidneys. In kidney disease, the kidneys may struggle to filter out waste products from protein metabolism, leading to a buildup of toxins in the blood. By reducing protein intake, particularly from animal sources like meat, poultry, and dairy, the workload on the kidneys is reduced. However, it's important to ensure an adequate intake of high-quality protein from plant-based sources like beans, lentils, and tofu to prevent malnutrition. Control phosphorus. Healthy kidneys regulate phosphorus levels in the blood by excreting excess phosphorus through urine. In kidney disease, impaired kidney function can lead to high levels of phosphorus, which can weaken bones, calcify soft tissues, and increase the risk of cardiovascular complications. Foods rich in phosphorus, such as dairy, nuts, seeds, whole grains, and processed foods, should be limited. Phosphorus binders may also be prescribed to help control phosphorus absorption from food. Watch potassium intake. Potassium plays a vital role in muscle and nerve function. But excess potassium can be dangerous, especially for individuals with kidney disease. Impaired kidneys may struggle to remove potassium from the blood, leading to hyperkalemia, which can cause abnormal heart rhythms and even cardiac arrest. Foods high in potassium, such as bananas, oranges, potatoes, tomatoes, and leafy greens, should be limited or avoided. Cooking techniques like leaching and soaking can help reduce potassium content in certain foods. Now that we've discussed foods to avoid, let's switch gears and talk about some dietary strategies you can implement to support your kidney health. Firstly, it's crucial to manage sodium intake. Sodium can contribute to fluid retention and high blood pressure, both of which are common complications of kidney disease. Excess sodium intake can worsen fluid retention and increase the risk of heart disease. To limit sodium intake, avoid processed and packaged foods, as well as restaurant meals, which are often high in sodium. Instead, opt for fresh whole foods and use herbs, spices, and lemon juice to add flavor to meals. Secondly, monitoring fluid intake is important. Impaired kidneys may lose the ability to regulate fluid balance, leading to fluid retention, swelling, and high blood pressure. Limiting fluid intake helps prevent fluid overload and reduce the workload on the kidneys. Fluid intake recommendations vary depending on factors like urine output, medications, and individual health status. Monitoring fluid intake from both beverages and foods with high water content, such as soups, fruits, and vegetables, is crucial for managing fluid balance. Lastly, choose healthy fats. Healthy fats provide essential fatty acids and fat-soluble vitamins without putting extra strain on the kidneys. Opt for sources of unsaturated fats such as nuts, seeds, avocados, and olive oil, while limiting saturated and trans fats found in fried foods, processed snacks, and fatty meats. Including omega-3 fatty acids from fatty fish like salmon and mackerel can also have anti-inflammatory effects and support heart health. Now, let's talk about something a little different but still incredibly important in managing kidney health: phosphorus binders. Phosphorus binders are medications that can help control phosphorus levels in your blood. They work by binding to phosphorus in your digestive tract, which prevents its absorption into your bloodstream. This can be particularly beneficial if you have kidney disease, as it can help manage your phosphorus levels and reduce the risk of complications. High phosphorus levels can lead to problems like bone disease and cardiovascular disease, so it's crucial to keep them in check. While these binders can be a great help, they are often prescribed alongside dietary changes, so you can't rely solely on them. As we have discussed, you need to avoid certain foods and incorporate healthier ones into your diet. Managing kidney disease is a holistic process. It involves dietary changes, medication, and close collaboration with healthcare professionals. So, make sure to work closely with your healthcare team, including a nephrologist and a registered dietitian. They can help develop a personalized dietary plan based on your specific needs and health status. Remember, every step you take towards managing your kidney health counts, and each positive change can significantly improve your overall well-being. Stay tuned for our next video.